Hey guys, today on Future Horizons, we're joined by the wonderful Dr. Wardah Saleem Kashmiri, a passionate and accomplished dentist who completed her dental school in Pakistan and recently completed her residency in oral medicine in the US. She was born and raised in Dubai and did her schooling from the British school system. From her years of diversity and experience caring for patients to a dedication to continuous learning and growth, Dr. Wardah brings a unique global perspective on the future of healthcare. We're so excited to hear her insights, stories, and advice for aspiring professionals. Welcome to Dr. Horizons, Dr. Wardah.
I am very well. Thank you so much for having me here today.
Yeah, no worries. Thank you for joining us.
Of course.
Can you tell us a little about your journey into dentistry and what inspired you to become a dentist?
Well, since I was growing up, I would always spend time with my father, and he was a lot into public service, just being there for everybody, their needs. He wasn't a doctor though, but just seeing him so passionate about serving the humanity in all aspects that he could, uh, I think it just framed my mind in such a way that I'd love to get into something that I can do to serve the community, the people of the community, and it just led me into going into healthcare.
Thank you. What has been your most memorable experience working as a dentist so far?
That's a great question. So, like I mentioned, this was my mother's dream, all along. And then finally, I am grateful that I actually got part of this fulfilling the dream because it became mine too. So, I remember I was in my third year of dental school, and that's when we start working on patients in clinics. And then I had this patient who actually came in with extreme pain, in his tooth. Fast forward, getting all the investigations done, diagnosis, and then following the treatment. I remember that day when the patient actually cried tears of relief. And he was like, "Thank you so much, Dr. Wardah. Thank you so much. You have no idea how badly I was in pain, and you've relieved it for me." And that just left me astonished. And I was like, wow, was I able to actually help someone? And I remember calling my mom back and letting her, I was crying and I was like, Mama, I am so grateful that you put me into this field because I was able to do something for someone else. And that is where it started inspiring me even further and more harder.
What a beautiful story.
Yeah,
Thank you for sharing.
of course.
What do you find most rewarding about working in dentistry?
Relieving them of their pain.
That's a great
Yes.
answer.
Yes.
Can you share some challenges you faced during training or practice and how you overcame them?
Oh, yes, everything comes with challenges. Another great question. So, dental school had different challenges, and my residency had different challenges. So, challenges I faced in dental school, I was away from family. I lived in another country, and I had to travel to another country to get my dental school done. So, that was the biggest challenge at that stage of my life. And then challenges I faced when I was doing my residency, which is just, following in the past 2 years. I already have a family of my own where I have my own children and my husband. Mm-hmm. So I was not away from family, but taking care of them and their needs, as well as trying to accomplish my goals in residency, where, you have to go through a rigorous pathway. You're 24/7 working, you're on call, managing all that with a household had its own challenge. It came with its own perks. But I would say, if your question is how I tried overcoming them, I believe time management and planning things out. Yeah, it's not easy, but it's not difficult. Yeah.
Thank you. It's
Of
very
course.
inspiring.
Yeah.
What were your hours like in dental school and residency?
So my hours in dental school separately and residency, uh, they were quite similar. Dental school, I believe, was a little lighter because I wasn't on call. Residency, I was on call, which means I would be paged any time of the day, any day of the week, and then if needed, I had to rush into the hospital to cater to the needs of the patient. Dental school, I had no other responsibilities except for just being a student. I was a young girl who had just left her home, traveled and flew to another country. I was living with my grandma in another country while going to dental school. So it was all about me just dedicating all my time to my education, During the day, it was my classes, and then right after my classes, I would stop by at a library or just do some study groups with my colleagues and my friends. And then, yeah, that's how it was.
Do you have any techniques you use to like study or?
What I would do is there's something I really like about how I have tried passing my exams, like especially the high school exams. So I did the British curriculum, which was the O levels and A levels. What I would do is, and I'm talking about subjects like physics and chemistry, which actually requires a lot of calculations. And I feel like, some people are good at math and calculations, some aren't. So how I would instill that in my mind is I would record it. I would record those formulas. I would record definitions, and I would keep listening to it. So I remember I had my final physics IGCSE exam, or my O levels, and then my friends were like, "Why are you listening to music on your Walkman?" We used Walkman back then, and I was like, "I'm not listening to music. I'm actually listening to a recording of the exam. Like the preparation," and it helped me. Yeah, so that was my way. But of course, people like to keep writing and repeating. People like to keep recording and then listening to it. There are various ways how you can just try to stick it into your memory and then go for it.
What a beautiful method. I'll definitely have to try that out someday.
Oh yes.
What advice would you give to high school students or young adults considering a career in dentistry?
Okay, tough one. You need a lot of commitment. So specifically, you're going into dentistry. It is a lot about handwork. You do a lot of procedures. So straight when you're out of dental school, you're actually a surgeon. You're extracting teeth. You're putting in sutures. You're probably putting in implants. Going into your oral cavity with a handpiece that runs on a particular speed. This is not everybody's cup of tea. A dentist can actually hold that handpiece with such a great or high speed and work around delicately on that tooth without damaging the tongue or the gums or the inner cheeks. So it is a great deal of a commitment. It is a great deal of a job. And I believe if you have commitment, dedication, you're up for this field.
Precision and dedication are definitely key.
Oh, yes, yes.
How do you see the field of dentistry evolving within the next 5 to 10 years? Do you think AI is going to have a larger role or?
AI can do everything, but I don't think AI is going to will be able to do the procedures which a dentist can. So I think this is going to be a successful, evolving field, no matter in how many years in the future. I think it's a great field. It's going to keep human touch into the field. So,
I'm glad to hear
yes,
that.
yeah.
It's a relief. What skills or qualities do you think are most important for becoming a successful dentist?
Empathy. I believe that is one of your huge attribute to actually pursue the field of dentistry, where you're working in healthcare, serving patients. You need to be able to connect to them and their concerns of either pain or, they could come with multiple concerns when they come into a dentist's office. For example, as an oral medicine specialist, I see a lot of patients who come in with concerns of, or I would say that we end up diagnosing them with burning mouth syndrome. Without overwhelming the audience about going into the nitty-gritty of burning mouth syndrome, it is basically a condition where you rule out every other underlying disease or condition, and it is just it's a chief complaint of a patient where they consistently mention that their tongue or their lips are burning. And clinically and visibly, if you look into their oral cavity, there is nothing that you can absolutely point at, or even they are basically lost in that direction. So coming to terms with understanding their actual concern, diagnosing it the right way, and then treating it the right way is a huge it's a huge deal, because this usually takes a toll over their psychological aspect as well. So you're basically managing the burning, and you're also managing their psychological concerns regarding that burning, which you cannot visibly see, but it's there. So yes, empathy.
It must be difficult, like when you can't see a condition, you're having to diagnose it.
Oh yes. I've had an incident, and if it's okay for me to just give you
Yes, of course.
2 minutes of that. So I had this patient who basically has been coming for a very long time, and without getting into any details, HIPAA, which is I give identifications of the patient, but a very nice lady in her mid 50s. Um, she's been coming with the diagnosis of burning mouth syndrome, which obviously sometimes is at that level where she has seriously been psychologically affected. And apart from just treating that condition, we've had to do like longer counseling sessions with her. So, at times it also takes a toll over the provider, because you can see the patient is in pain. You're trying your best to treat that patient, and you're always not successful. Or maybe it takes you time to reach that point where the patient's quality of life has improved. So that waiting game sometimes does take a toll over the provider, and then you need to like understand, be there for the patient, just half of the time I feel like you counsel the patient and the patient feels okay. So, yeah, again, I circle back to the word empathy. It is a must when you're getting into the healthcare field. Yeah.
I can imagine it must be hard, like seeing a patient and knowing you can't like immediately give them a cure.
Oh, yes. Yeah. Yeah.
Can you share any tips for balancing work and personal life in the healthcare field?
Another tough question. Where are you getting these great questions from? But not easy again. You have to be committed. You have to be strategic. You need to plan your time. As a mother of 3 children and a wife, of my dear husband, who's been very supportive throughout my journey, I feel there are like 3 main things you need to ensure that it's okay. The kids are safe, they're eating, and they're doing good at school. So this was important for me at this current stage of my residency. Now, if you go back at dental school, obviously you do not have any responsibilities other than just studying. It is quite easier to manage your time, because you're going to get your food cooked by your parents, you're going to get your laundry washed, you're going to get everything else sorted. So at this time of my life, where I had to ensure all of this was done for my children while I was ensuring I am doing the best at my field, planning meals ahead of time, dedicating time for each assignment, basically, yeah. It's just dedicating time and planning, making a strategic plan, probably making meals over a weekend, which I know I'm not going to be on call, and just stacking them up in the fridge or the refrigerator to use for the following week. Getting everybody involved. You need to also delegate tasks to people in the house. You do this and you do this. And that is how, it's a teamwork, and that is how you can succeed in managing your household and your career outside.
Yeah, time management and dedicating tasks.
Yes.
Both very key concepts.
Oh, yes.
Is there a particular area of dentistry you're especially passionate about, and why?
My subspecialty, oral medicine. Yes, I am very passionate about oral medicine, which is why I pursued my residency in this particular field. It is a fairly new field. It has recently been recognized by the ADA, which is the American Dental Association, and but it's been into existence since 1945. So oral medicine, I'll just give you a little insight about oral medicine, and I'll answer your question of why I am very passionate about it. It is a bridge between dentistry and medicine. So it basically connects both the fields. We, as oral medicine specialists, we collaborate with rheumatologists, because there are many autoimmune conditions in your body which show up in your oral cavity, and those are some particular manifestations in the oral cavity which we can, as oral medicine specialists, clinically see and then diagnose it, that this is the manifestation of this particular autoimmune condition that you're that the patient is facing, and then vice versa, and then you can actually refer them off. And then we also work with dermatologists, because there are some skin conditions which also show up in your oral cavity. And, this is like another collaboration. Mainly, the main focus of oral medicine is dealing with head and neck cancers. So this is the big C, which basically is a huge, anxiety for a lot of people. You get these lesions in your mouth, which you're not sure of what they are. And then we step in by doing a biopsy, which is removing part of that lesion and sending it to a pathology lab where they look into the details of confirmation if this lesion is a pre-malignant lesion, which is like pre-cancerous lesion, and if we should stop it there and then and how we can do it, or it just gives you an idea that, okay, there you go, this is the big C, it's a cancer, and these are your options, So I feel like that early diagnosis and detection in these cancerous lesions, it is very fulfilling, because if the patient comes to you on time and you can detect it, before it's too late, you're saving someone. So
it's a very important and impactful field.
Yes, absolutely. And the collaboration, I feel like that collaboration between different specialties, including oral medicine specialists, I believe this is, again, I always emphasize on teamwork. So this is a teamwork which caters to the needs of, patients requiring oral medicine treatments and procedures.
What an amazing field to be part of.
Oh, yes, of course.
That's super cool. I never knew about oral medicine. It's the first time I'm hearing this. Could you please tell me a bit more about what they diagnose?
Sure. So apart from all the other conditions that I mentioned, we also do sleep medicine. That is also, not entirely covered, but under the scope of an oral medicine specialist, where if there are patients who are diagnosed with sleep apnea, which is when, you have sleep disorders, you're probably not, you're snoring at night, and that obviously, leads in disruption of breathing well and oxygen reaching your brain. There's a gold standard treatment for that, which is using a CPAP appliance. It is like a mask which you wear on your, around your nose and mouth, and then you have different pieces, headgear and all of that. Again, without getting into a lot of details, but an alternative to that treatment, we oral medicine specialists fabricate a device which you wear intraorally. It does not require any electrical connections. It does not require any headgear and all those tubes and, the different parts of the CPAP. It is just one device which we basically gauge through different measurements. You wear it at night, and it tries to pull your lower jaw forward. It gives you space where you can actually breathe well and sleep well. So it does help. It is very effective in helping treating sleep apnea. And this is what an oral medicine specialist does as well. Another thing that we see is the TMD concerns. So in this era where life is fast, it is like high paced. There's no time where you're giving yourself. It usually shows up towards the night time when you're resting and sleeping. You start clenching your jaw. You'll see about 80-90% of the population probably talking about, soreness in the morning, or probably in the teeth, in the muscles on the cheek. It is because you're clenching your teeth and your jaws at night. It gives rise to either muscular pain, or sometimes you have these degenerative changes in your bone here. This also gives rise to DMD concerns. TMD is temporomandibular disorders. So this is another aspect of oral medicine that we treat, we diagnose, and then we go forward with giving you different methods. It could be conservative, it could be medications, and so on. So we're covering a lot. Oral medicine is vague. It has a huge umbrella which covers teeny weeny aspects of every other condition. So, yep.
It's pretty cool.
Yeah.
Sounds like a lot of fun.
Oh, I would encourage a lot of you, if you're pursuing dentistry, I would say keep that as your end goal. Specialize in oral medicine. We need more oral medicine specialists.
Yes, definitely.
Yes.
What's one misconception people have about dentists?
That's a very funny and a good question, because I have faced that all my life. So people ask me, oh, you're a doctor. What kind of a doctor are you? And I'm like, oh, I treat teeth. Oh, so you're not a doctor, you're a dentist. I'm like, no, I'm a doctor, because I am just not treating teeth. I'm treating teeth in a human body's mouth. So basically, I need to know everything else going on in that body before I treat that one tooth which is in that living body's mouth, just in case I am giving rise to other bacterial infections or anything else that can go wrong, what in the process of me treating or diagnosing the patient. So yeah, this is one misconception. Dentists are doctors. Yes.
I definitely agree with that.
Yes.
If you weren't a dentist, what other career would you have pursued?
To become a president of my country.
Oh wow, I wasn't expecting that. Can you tell me a bit more about?
I would love to. So when I was growing up, yes, it was my mother's dream that I become a doctor. But when I was growing up, I saw how my father was not very active, but he was involved, with politics, and we had a lot of he had a lot of friends who were political leaders. I would see how they would meet up, have press conferences. This is how my childhood was. Growing up, seeing them talk, discuss on, the position of the country, economics and so on. It sort of inspired that I would love to do something of that sort. And I remember at one point, so my parents are originally from Pakistan. I am originally from Pakistan. And I remember growing up and telling him that one day I will be the Prime Minister of Pakistan, and he was like totally trying to help me get in. And my mother was like, no, I think you should be a doctor. But today, here I am. I'm an American now, so I don't know if I can be the President of America, but let's see. I do have some political, I like working with the government. I like serving the community. These are my other goals and passions apart from dentistry, where I lead some healthcare community events. And it always includes, having the government leaders interact with us and be part of those successful events where we're helping out the community in need. So yes, I have a mixture in all my passions.
That's beautiful. I love your various different passions.
Yeah. I'm happy to share this with you, actually.
Yeah, thank you.
Of course.
We at Future Horizons would like to thank Dr. Wardah Saleem Kashmiri for sharing her insights in dentistry. Her email will be linked below if you guys have any questions.
Thank you so much, Future Horizons. Good luck and keep up the great work.
Thank you. Have a
Yes.
good day.
Thank you for having me.